My name, uh, my name is Charles Murray. I'm the W.H. Brady Scholar here at the American Enterprise Institute. And seated on my right, as it were, is Jared Bernstein, who is a senior fellow at the Center on Budget and Policy Priorities. If you came here looking for a knockdown, drag-out debate, I'm afraid you're going to be disappointed. The fact that we don't have a moderator is an indication that actually Jared and I generally enjoy talking to each other about issues on which we disagree. And I don't even know the extent to which we disagree on the topic
Oh, you'll see.
It's good that you do, because otherwise this would be pretty boring.
Too much of a love fest.
The topic tonight is a universal basic income, UBI. I had published a book on this in 2006. I've actually been interested in the concept since the 1980s. And I republished a revised version of it this year for a couple of reasons. One is that in 2006, I was saying, well, we couldn't afford it right now with the same budget we have, but we could afford it by about 2011. I was actually off by a couple of years. We passed the break-even point in 2009, but now we are well above the break-even point. In other words, we could implement the plan that I present in the book in our hands for less money than we currently have in transfers. And that situation is going to get dramatically worse, if you want to think of it that way, over the next several years, because we do have rising entitlement costs. We can look out pretty confidently into the future and see budget deficits that are extremely serious. And I would say that one way or another there has to be major reform. Congress does not do major reform unless it absolutely has to, and I think it will absolutely have to. That was one reason. A second reason is that much more than in 2006, I am aware of a huge shift that's taking place in the job market and is not 50 years down the road, it's 10, 20 years down the road. The obvious example are things like truck drivers and the advent of driverless trucks and driverless cars, which will be upon us probably within a decade. But actually the much scarier aspects in terms of just the sheer numbers and the nature of the changes are in white-collar jobs, where after decades of being overhyped, artificial intelligence is going to carve out very large numbers of jobs that up until now have been held by people often with college degrees, above average intelligence, having to make complex decisions, and a lot of those jobs are going to go away. Think travel agents in terms of things that have already been appearing. That was the second reason. Third reason is, and I'll just finish that off by saying, I think we are looking forward to a future in which living a satisfying life will still involve vocation, but it won't necessarily be vocation as defined in terms of a 9-to-5, 40-hour-a-week job. And the third reason is the same reason that I was interested in the guaranteed income back in 2006, and that is I think it offers a chance to revitalize American civil society. I'm going to make a very brief statement on what the plan consists of and what I would hope it achieves. Try to hold that within 10 or 11 minutes, and then Jared will have a chance to respond at length, and then we'll go on a back and forth on the things that we do disagree on, and we'll open it up for questions later. First, the basics of the plan as I present it. I will start out by saying that a universal basic income could be a disaster. I think if it were an add-on to the current system, it would be a disaster for all the reasons that a lot of people say it would be. However, if it replaces everything else, then both financially it becomes more feasible and a variety of good things, I think, happen that wouldn't happen otherwise. So we replace all transfers with the universal basic income. And by all transfers, I include in that Social Security, Medicare, Medicaid, all welfare programs, all agricultural subsidies, all corporate welfare, anything that constitutes a transfer from some American taxpayers to other American citizens, as opposed to things like police protection and national defense and so forth. It is in the amount in the plan of $13,000 per year for every person in the United States, citizen, who is 21 years or older. You need to have an electronic deposits into a known bank account to get the plan. There are some reasons for that stipulation. In monthly installments. Now, here is the stipulation I have in my plan is $3,000 of that must be used for health insurance. That is a very complicated subject. If Jared wants to get into that, I'm happy to do it. I'm going to leave it out of this initial presentation and say, look, one way or another, carve $3,000 of that out, and let's say we're talking in terms of money, disposable income, $10,000 a year. You can't live on $10,000 a year, you're saying to me. Well, you're right. If you want to live all by yourself, without reference to anybody else, that's true. And if you don't want to work at all, that's true. You can very easily make a decent living for yourself if everybody else has $10,000 a year and you're willing to cooperate. If you can get together with a boyfriend or a girlfriend or relative or friend or anybody else, just two of you, still not working, that's $20,000 a year. If you hold down a minimum wage job, let's say a $7.50 an hour job, and you work for 2,000 hours in a year, that's $15,000, so that's $25,000. If you were living with someone else, that's $35,000. You can go through a lot of permutations and say that the universal basic income makes it really easy for people doing very ordinary things to live well above the poverty line, and forget the poverty line too. It makes it easy to get into the middle class. If you have a couple where you have a $20,000 increment and some fairly low-paying jobs, you're getting into middle-class incomes. And with that comes progress against poverty that has eluded us for the last 40 years. It has all sorts of ways in making retirement, a comfortable retirement, easier than it is under Social Security, especially for low-income earners. A lot of these things are issues that I have to explicate to make my case, but I'll assert that and move on. A couple of features in the plan I think are really important, and let me pause for a moment. I know that this plan could never be enacted exactly as I specify it. When I say they're really important, what I mean is whatever version of this might actually be considered, the things I'm about to say, I think, need to be taken into account. One is you need a really high payback point. In my plan, I start to claw back some part of the grant at $30,000 of earned income. And at that point, you pay a 10% tax on every $1,000. There's a graduated tax schedule between $30,000 and $60,000. The point is this. Current programs have terrible marginal tax rates, so that if you have Medicaid and some forms, food stamps and some other forms of assistance, it can be very dicey for you to get a job because you lose those. If you are on disability, and I think the people in this room are aware of the massive increase in the disability program, which includes lots of people who may have a real disability for certain kinds of jobs but could easily hold other kinds of jobs, they cannot go to work without jeopardizing what they in fact have as a guaranteed lifetime income, and quite naturally a lot of people don't want to do that. So if you have the high payback point, you sidestep all of those traps, and you really lure people into working until they can't afford to quit. So that if somebody has been working at a job and gotten raises and now gets up to $30,000, they have a net of 40. At that point, I don't think very many of them are going to quit working because they have to start paying a small amount of the grant back and go from a $40,000 a year lifestyle to a $10,000 a year lifestyle. Let me move on from that to a brief outline of why I say that I think a UBI offers a chance to revitalize American civil society. It's a complicated argument in a lot of ways. Let me put it in terms of one of the things that's most commonly brought up to me as a reason you don't want to do it is that you're going to have people who drink up their money before the end of the month, and if you've taken away all of the government programs to deal with this, what's going to happen to these people? And what's going to happen is that they're going to have to seek help. But it can't be going down to the bureaucracy downtown. They're going to have to talk to the girlfriend, the boyfriend, the relative, the friend, the Salvation Army, and say, I'm tapped out, gee, I don't have anywhere to go, you got to help me. You have changed the dynamic. The person who is doing that no longer is a victim who has no resources. America does not have a history of letting people die in the streets, and friends don't have a history of letting friends die in the streets. And so here's the kind of response I envision, which I do not think is naive. I think it's entirely practical. That you're going to have, let's say it's the girlfriend, say, okay, I'm not going to let you starve, but don't tell me that there's nothing you can do because I know the first of the month you've got another 800 some bucks coming into your bank account. It's time you got your act together. Multiply that kind of interaction by millions of times every day around the country in terms of people who have human needs. And what I'm saying is that dealing with those human needs is going to be pushed down to the level where you have the best chance of getting an effect. Because if there is one thing that anybody who has ever worked with people with serious problems knows, it is that some people need a pat on the back and a helping hand and sympathy, and other people need a kick in the pants. And the people who know best how to do that are the people who are closest to them, the people who are most ineffectual at doing that are government bureaucracies, because government bureaucracies must be run by rules, and rules are not very easily adapted to the complexities of human needs. But the ways in which it revitalizes civil society is not limited to the people who have lots of problems and need to have those problems addressed. It goes to one of the things that made America exceptional. Not exceptional in our eyes, bragging about the United States, but exceptional in terms of the Europeans' eyes who came over here in the 19th century and went home saying, we've never seen anything quite like this. And that is the extent to which American communities, especially in the North and West, dealt with their problems, forming associations, as Tocqueville famously described, but also in all sorts of informal ways. There were very few, if any, societies around the world which did it as we did. I have sometimes made the case and tried to document it with numbers that if you took the philanthropic efforts in New York City at the end of the 19th century, I am willing to go to the wall saying the amounts of money and effort spent on those were far more than the tax base of New York City could have ever matched in terms of government services if they decided to do government programs. A lot of that has gone away. I want to see that come back because that is the stuff of life of communities. That's what makes living in a community rewarding in the same way that you worry about what makes a vocation rewarding, what makes a family rewarding. And the title of the book, In Our Hands, comes from that concept of putting life back in our hands as individuals, our hands as families, and our hands as communities. So I'll stop there, turn it over to Jared.
Well, thank you, Charles. It's a pleasure to hear you talk about civil discourse, because I consider you a master at that on one-on-one. It's one of the reasons I enjoy interacting with you. A couple of books ago, Charles wrote a book called Coming Apart, which I read at the time, and I liked a lot of what I read in there, and I didn't realize at the time, I'm not sure if you did, but it very much presages a lot of the dynamics in the current election, in my view. And if you haven't read that, you should go back and look at it. This current book, I have many more disagreements with. And what I'd like to do is talk about why I think Charles' idea for a universal basic income is misguided in the sense that it would compound some of the problems we have in our economy. It would get rid of a number of important programs that have evolved in ways that in which they're having their intended effect and extremely effectively and efficiently doing what they're supposed to do, which is not easy to do in social policy in an 18+ trillion dollar economy. A lot of my reaction to reading in our hands this edition was what we have is not broken, don't fix it, and the fix is a lot worse than the current system. And then I want to talk a little bit about this notion of jobs and the kind of the future of work, because here Charles is part of a larger movement wherein many social and economic commentators are very much concerned about the future of work from the perspective you heard from Charles, and thinking that UBI is a solution to that. I'm going to disagree with that, but I'm going to try to end, and this will all take 10 minutes tops, on a note of agreement. Areas in which I think Charles plumbs, as he always does, something worth elevating and perhaps agreeing upon if we can. I have a pretty significant wrinkle that I'm going to dangle in front of you and see if you nibble. So this may be somewhat of an apostasy here at AEI, but I will assert, based on extensive evidence, that Social Security, Medicare, Medicaid, the Affordable Care Act, and the safety net are all working very well, having their intended effects efficiently and effectively. There are certainly aspects of those programs that need work. As Charles suggested, solvency issues must be resolved for the large social insurance programs. But in the very first page of his book, he says, suspend political disbelief, which is actually a very reasonable thing, because if you're going to read about a really very large game changer like a UBI, you kind of have to suspend political belief. Unfortunately, if you're talking about almost any policy change in this town these days, you have to suspend political disbelief. But I would argue that, in fact, achieving the solvency of the big social insurance programs is a less heavy lift than getting to any of these kinds of changes that Charles is introducing. So I hope in our commentary I can say more about this, but let me just start out with Social Security and work my way through that list quickly. Social Security. In the absence of Social Security, elderly poverty would be about 44%. Social Security takes it down to about 9%. The administrative cost of Social Security used to be 2% of benefits paid, which was already far above any kind of private sector retirement program of the type that Charles is implicitly advocating for. It's now down to 0.5%. The administration of Social Security is 0.5% of benefits paid. Social Security, risk-adjusted, provides the same returns as the kind of stock market investments that Charles touts. And by risk-adjusted, I mean what you have to factor in, and I didn't see this anywhere in our hands, is the inherent risk in putting a retirement account in the stock market. We had this debate during the private account days of G.W. Bush, and one of the reasons it went away, I was happy to see, was in part because the market kind of tanked around when we were having this debate, which reminded people of the importance of accounting for risk when we're talking about a pension program, Social Security, a guaranteed pension program. Charles also says nothing about transition costs, which are huge when you're moving away from Social Security to something more variable. Medicare. Medicare not only is, like Social Security, a deeply beloved program, so I think you'd have some real headaches trying to deal with that aspect, with getting rid of that, but it also is, again, a highly efficient program. And Medicare, if you look at the costs of the cost increases, and of course, if you want to ask where are our fiscal pressures coming from, they are from precisely cost pressures from healthcare in particular. You will find that consistently, year in, year out, Medicare and Medicaid grow more slowly than the cost of private health coverage, even controlling for age and people's medical conditions. So again, a highly efficient program. Now, what about the ACA? Well, two things. First of all, do yourself a favor, it's not hard to find. Look at a plot of the uninsurance rate, so the share of the population that lacks insurance. And draw a line where the ACA comes into play. If you do this for non-children, if you do this for adults, you'll see, especially working age adults, you'll see particularly what I mean. By the way, Charles would get rid of child insurance as well, CHIP. Draw a line where the ACA comes into play. You will see that after ticking up for year in, year out, the uninsurance rate drops off a cliff. It was 16%. You want this to go down because it's the rate of people that are uninsured. It was 16% in 2010. It's about 9% today. The ACA, and this also has to do with changes in Medicare delivery, the ACA, if you look at projections of healthcare spending, the kinds of delivery measures that are in the ACA and other things that are going on at the same time, it's not all the ACA by a long shot, have reduced our projections of healthcare expenditures by 4 percentage points of GDP. That's something like $800 billion if you take this out a couple of decades, as CBO does. So these programs are proving to be both efficient, effective, and are, as we used to say, bending the cost curve in ways that are extremely important and that I fear going to the private sector solution that Charles advocates won't get us there. Now, the safety net. I very much disagree with Charles' assertions about the extent of work disincentives in the safety net. I think there may have been a time when that was more of a problem. There was a time when that was more of a problem. But over the last 20 years, the safety net has become increasingly conditioned on work. And in fact, if you're disabled, elderly, or a working person, the safety net is now much more tilted towards you than it is against you. Now, this causes another problem, which is we have a larger share of households in deep poverty who are disconnected from the job market. And by the way, here, a cash grant would probably be helpful on top of what we're doing already as opposed to replacing it. But again, we're not doing PowerPoints here, which is fine. It's probably as it should be. But let me describe a graph. If you look at the poverty rate, and not the official poverty rate, which is often cited in our hands, I think incorrectly, but the poverty rate adjusting for all the things that we've done to increase the anti-poverty effectiveness of our safety net. So the Earned Income Tax Credit, the Child Tax Credit, the expansion of nutritional support, those aren't in the official rate, but they're in the supplemental rate. And the supplemental rate has come down from about 26% in the late 1960s to about 14.5% today. It's about a 45% decline in that supplemental rate. Moreover, look at how it performed in the Great Recession, the deepest recession we've had since the Great Depression. It barely budged, especially for kids. That means that the counter-cyclical impact of the safety net is more effective than it's ever been before. 2 more points, and then we'll turn things back over to Charles. It is simple math that if you're going to take a system, the system of transfers, which is disproportionately tilted towards those at the lower end of the pay scale. So it's simple arithmetic that if you're going to take a transfer system that is disproportionately targeted at poor and low-income people and distribute it among pretty much everyone, you're going to dilute the distributional impact of the transfer system. That is, you will be pushing back on the equity or the equality-inducing aspects of the safety net. So the safety net, as I've mentioned, offsets the increase in inequality, which we've seen in market incomes. UBI takes that away, pushes back the other way by taking a set of programs that are disproportionately targeted at the low end and diluting their anti-poverty or low-income effectiveness by distributing them broadly. And finally, on jobs. Now, here's the thing. Charles and the kinds of robots are coming for our jobs crowd may be right, nobody knows. And I want to stipulate that, and Charles doesn't say things lightly, and so I want to defer to certainly the possibility that the future will be different than the past. However, it is true that Luddites have always been wrong, and the idea that the future that technology will be unemploying-inducing in the future has never been correct. But here's why I'm so specifically doubtful about this claim in at least the near term. If, in fact, technology or labor substituting capital, if in fact capital that substitutes for workers, that substitutes for labor, was entering the workforce at an accelerating rate, we would see productivity growth accelerate. Okay, productivity growth is nothing but output per hour, labor hour, output per hour of work. So if we were creating more output with less work, which is what the technologists tell us is the symptom of this, we would be seeing productivity accelerate. Instead, we've seen productivity decelerate, and significantly so. In fact, I'd argue it's what we really should be arguing about up here, not so much UBI. And that is prima facie evidence that there is something wrong with this hypothesis. Now, that's very near term. And folks talking about robotics in the future of work are looking around distant corners. We've never been right about those distant corners. I'm afraid we're probably not now. But certainly you can't find any evidence that would lead you to believe that you'd want to take apart a system that I think is working extremely well, replace it with one that is inequality-inducing and less effective. I'll save my areas of agreement, because I have one that I agree with that we'll get to later, just so let me stop and let you react.
Sure. And I'll not try to react to everything you said, because then we'll be speaking in 15-minute chunks. Okay, so we have these efficient programs. We are spending state and local and national altogether about $2 trillion a year in transfer payments, and we still have millions of people in deep poverty. We still have millions of people without insurance, health insurance. We still have an intransigent set of people who are unable to live decent existences despite all of these efficient programs. And I guess that the thing that I will skip over the fact that I have an entire appendix on transition costs. That's okay. That you didn't read that, Jared. Reading appendices is asking a lot. And I will skip over that I never make a big deal out of the costs of the bureaucracies that administer these programs. I don't make a big deal out of that. Let's think about a guy who is low skill, and he's never going to be anything except low skill. And so if he gets in the labor market and stays in the labor market, he won't stay at minimum wage, but let's say he's going to be $10 an hour. And he works 1,500 hours a year, so that's $15,000. That's means that his $10,000 doesn't quite double, but boy, does it augment his income. That same guy under the current system, what can he get? He can get, you know these numbers better than I do. He can get some food stamps. He can get some other kinds of minor help. He doesn't get anything close to 10 grand every year in terms of what he can do. And entry into not just escaping from poverty, but entry into a more comfortable life is pretty much shut off to him in lots of ways, because the labor market will not pay a lot more than those things for really low-skill work. Now, think about marriage, which has been declining radically in the working class. Marriage, which is one of the best ways for all sorts of good things to occur. Well, all at once, if you get married and you're low income, and even if his wife doesn't work, they're at $35,000. That's a big difference from anything they'd have now. If she does work a little bit, you're up around 50 and so forth. I guess what I'm saying, Jared, is the current system is really bad at taking people who've drawn the short end of the stick on a variety of personal abilities and so forth, and giving them an avenue into which they can reasonably look forward to a good existence, and my plan does that. It's a huge transfer of money toward the lowest income groups, because I leave part of the grant, half of the grant basically, for the people who are above $60,000 in income. That's the price, the payoff to them for losing Medicare and Social Security. But I'd say that advantage of my plan is really important. Is there anything else I want to say before? No, let me just stop there and then throw it back to you.
Let's go back and forth on that a little bit, if you will. So I think that the guy you just mentioned, he doesn't have a family, right?
No, I started out with him not having
Yeah,
a family, then I ended up with him having a family. Yeah.
Oh, okay. So that guy is underserved by the system that I was touting. I agree with that point. And interestingly, one of the ways to help him, and this is just an aside because it's on the docket, and believe it or not, there's some bipartisan interest in doing this, is to expand the earned income tax credit to reach that guy. That is a single worker, take the guy Charles described, without any children, gets very little from the earned income credit, whereas a single parent with a couple of kids gets 5 to 6K max from the EITC. And in fact, I wanted to talk about that for a second. So two things. First of all, the safety net should not be viewed simply in terms of lining up dollars and seeing who gets more. And by the way, if you did that, I still think I'd come out on top because I was looking at some numbers. And some of this is pretty complicated because it involves a lot of calculations about benefits and intersection of different programs. But a colleague of mine at the Center on Budget was showing me some work suggesting that the bottom fifth gets on average about 15K a year in the kinds of transfers that we're talking about, and that's before Social Security. And that's important, as I'll suggest in a minute. So it is not clear. So I think my mathematical point about if you're just going to diffuse a bunch of transfers well up the income scale, even given your marginal tax rate on higher income people, you'd still be distributionally, that would be distributionally disequalizing. But if you look at, and we have a very nice paper that recently came out from the center that I think makes this point in a way that I wanted to be very explicit about it. So if you take a mom with a couple of kids, and she's working half-time at the minimum wage, she ends up with an income based on the benefits of her food stamps, or SNAP, nutritional support. It's over $6,000. Her EITC is $3,000. Her child tax credit's close to $700. You take that person, you even take out her payroll taxes, and this mom with a couple of kids is making $17,000. Now, she, instead of working half-time at the minimum wage, she doubles her effort and is working full-time. And the minimum wage stinks. $7.25 is too low. We might even agree on that. So this is a very low minimum wage. Double her work at the minimum wage. So this gets to Charles' point about work disincentives. Does she end up with less? Does she end up doing worse? Well, in fact, she loses about 1,500 in food stamps. She more than makes up with that with another 2,500 in EITC and about another 1,300 in a child tax credit. Her income goes from about 18,000 to about 26,000. 18,000 to about 26,000. That's the work incentives currently built into our system. Now recognize that as that's going on, she is contributing to Social Security. In fact, she's paying payroll taxes. Now Social Security is the part of Charles, getting rid of Social Security is the part of Charles' plan that I dislike the most. Because what Charles then does is he says everybody should invest in the stock market. They should put $2,000 a year in the stock market. There's no rule that they have to do that. This is Charles admonishing them, and I agree with his admonishment. That's what you should do. Well, guess what? A lot of people won't do that. They won't do it because they can't afford to do it. They might not do it because they have a hyperbolic discount rate, meaning they're just not giving a crap about the future. It's a different way of saying the same thing. Charles' solution in this case is a variable pension. Right? It's not a guaranteed pension like Social Security. It's a variable pension. And if they happen to retire in a bad year, boy, they're going to feel it. So again, this is the private account debate that I'm happy to have once again, although we did dispatch it, I think, pretty thoroughly. So let me stop there.
Okay. Now, here I have an issue because I want to move the topics along. A lot of people don't get Social Security. You can be 65 years old, and under a variety of conditions, you either get very little Social Security, you get none at all. Everybody, if they have been utterly improvident all their lives, they haven't saved a penny, they got their 10 grand. If there are two of them, they still got the 20 grand. It's, let me just make a blanket statement, and we'll say that Jared and I, to be continued. I think if you talk about putting money in the pockets of low-income people, I think I can go to the mat with you on numbers and come out looking very good.
We should do.
Okay, but I'm going to put that aside, and let me just bring up another topic that I want to get to, and that is the future of work and also where we stand right now. Labor force participation has been dropping, especially, of course, notoriously among whites, and even more notoriously among white males. We are now down at historically unprecedented rates of able-bodied males of prime working age who are out of the labor force, and that has been secularly increasing. In addition to that, we have the question of the jobs. I absolutely grant you the Luddites have been wrong for 2 centuries, okay? This time is different, is a very dicey proposition to make. I would argue with you that with the previous transitions, you could have a rational person who could have foreseen that things weren't going to be so bad, that when buggy whips were no longer needed and horses were no longer needed, that a person could have quite reasonably said, yeah, but you'll need mechanics. You'll need these other kinds of things that are going to generate jobs. What do you need to replace the jobs of the drivers, one of the largest employment sectors in the country who are going to be without jobs? What are you going to do with millions of white-collar? Here's Jared. I got to raise this quickly. And as a guy who has written about IQ, I know the morass into which I am stepping. But the fact is that you have, I'll put it in terms of IQ. We had a society in which you have an IQ of 105, 110, which is above average. There were a whole lot of really good paying jobs because you could do things that required the ability to make these kinds of judgments. And it is really scary to which massive numbers of those jobs are going to disappear. And there are examples I could give to you. Let me put it this way, Jared. Can I prove to you that this time is different? Certainly I can't in the confines of this hour. I would have a hard time doing it if we'd spent 3 hours on it. It is something I think all of us ought to be thinking carefully about. Because
I agree with that.
we are looking at it, and just one final comment on this. The decline in social capital that Bob Putnam made famous with bowling alone has continued. And a lot of the reasons it has continued have to do with the fact that some other good things occurred, such as women going into the labor force and having the opportunity to go into the labor force. I think that was a good thing. Good things can have collateral effects that aren't so good. And one of those collateral effects was that an awful lot of what women contributed before they were in the formal labor force were huge amounts of social capital in the form of just making communities work. I am not in any way, in any form, let it be perfectly clear, I am not recommending that we encourage women to get out of the labor force. I am saying that the UBI would make it possible for women who want to be out of the formal labor force and at home, raising children and being deeply engaged in the community. It makes it easier for that to happen, and that's a good thing. It also opens up ways in which guys who do not have a place in the labor force to come will be able to find ways in which they can legitimately say to themselves, I'm doing stuff where I live that is valued, and if I weren't doing it, I would be missed. And I think those are important collateral things to worry about.
How about I make a closing statement?
And then we'll go to questions, yeah.
Because you land in a place that there may be some agreement. One of the things I like about a universal income of some sort is it does allow people not to take really lousy jobs they don't want, and in that sense increases their bargaining power. In my judgment, as someone who's been a student of the wage distribution for about 3 decades now, is that the lack of bargaining power is a critical deficit for low-income people. So here, let me close with a final critique of the idea, but then again suggest an idea that maybe there's common ground. What we It was interesting to me to hear Charles say, I left out defense, I left out police because these are expenditures that don't count as transfers, and I agree with that. These are agreements that society has some public goods that they want to fund. Well, I cast a broader umbrella of public goods than I think Charles does, and certainly most libertarians do. But it's one that I think I share with most Americans, and that's the idea of investments. Investments in retirement security, such that we as a nation have agreed back since the 1930s that we're going to have a guaranteed pension for the elderly. It could be improved, no question, but the idea of a variable, you're on your own pension and here's a couple $1,000 and I hope you invested in the market fruitfully. No, we're going to have a guaranteed pension for the elderly. We're going to have health care security, and this is Medicare, which Charles's UBI also gets rid of. We're going to have a safety net that isn't just a set of consumption programs, food stamps, EITC, Medicaid, Head Start. These programs, now that we have longitudinal data over generations, have been found to work like investments. They don't just fill a belly today. They lead to less obesity, better educational outcomes, better employment outcomes, better educational outcomes, better earnings outcomes 20 years hence. So kids who grew up getting these benefits actually did better than similarly placed kids who didn't get them when they're adults. These are investment programs. We invest. And our investments are in areas where we agree, I think, that market failures will not lead to excessive elderly poverty, child poverty, health care deprivation among the elderly. So that's my signature objection to the plan. Now, about the jobs thing, and I think Nick Eberstadt is here or was here, and he has a really worth reading new book on this. I have another dissenting, I guess I have a cottage industry now of disagreeing with people from AEI, where I have a chapter where I disagree with Nick's diagnosis, but his evidence is extremely well put together. So check that out. The problem we have, and now I'm going to talk like the macroeconomist, which is how I spend my working days. The problem we have in our economy is one of lack of demand. We have output gaps, meaning that the potential for GDP is consistently been above the actual GDP. If we were fully employed, we'd be generating more output. We have been at full employment in our job market only 30% of the time since 1980. I mean, this is a massive market failure. We've been at full employment only 30% of the time since 1980. That's CBO data of like a point-and-click calculation you can do yourself. There's nothing devilish about it. Until we establish that we have tapped all the demand we can and used the cyclical benefits of a strong demand economy to pull people back into the job market, one of the points I made about Nick's work is that the employment to population ratio, the employment ratio, which fell so much during the Great Recession, has climbed 2/3 of the way back. It is a very cyclical variable. It's not that people are running away from work, it's that there's not enough jobs. And so I'm very hesitant, as long as we have output gaps in the absence of full employment and persistently weak demand, to sign off on a technological unemployment thesis that is disproved, that has always been wrong, and I'm especially loath to replace it with a program that I fear will increase inequality and privation. Now, here's the thing I agree on. Here we may agree.
I've been waiting for this.
What if, instead of a UBI, what if we had a guaranteed jobs program? I think there's a lot of work to do out there. We may disagree on that, but at least based on the numbers that I just cited, absence of full employment, macroeconomic deficits, what if instead of guaranteeing people income, we guaranteed them jobs? And I think you'll agree with me that politically, that's a less heavy lift, because people will, there are people even in this institute who will blanch at the idea of just writing checks, whereas having people work is something that's kind of more consistent with even your work if you go back to your welfare work. So what about that, a guaranteed job?
Nah. Look, my problem with it is this, Jared, and that is the government's a lousy employer.
What if we guaranteed private job, private sector job, where we would subsidize?
That's
subsidized private sector.
Here's what you hear when you go to employers These are not Simon Legree's. These are employers just trying to run their businesses. And they say, all I want is somebody who will show up on time every day, doesn't take half-hour bathroom breaks every 3 hours, and can deal with his coworkers. And I'm having a terrible time getting those. And there are the stories about jobs going unfilled because employers can't find people with these really basic these skills. They're real. And so if you had, you know what I think it would be? I think it'd be a replay of CETA. A CETA for those of you, for you youngsters, in the room, this is the 1970s, very, very big Comprehensive Employment and Training Act for young people especially. And I think you'd get a repeat of that. I'm going to go I'm just going to go to questions now. Yes, sir. And wait for the microphone, please.
Make it a question.
And do make it a question, please.
Hi, I'm Wen Zhenhuang from Taiwan, and I have one question. I enjoy a lot from both gentlemen's arguments, but have you ignored one big fact both of you ignore in these arguments, that people can have mobility? All of your arguments based on one American, one society. American can only have job or good life in American society. However, have you considered that some people could be more valuable in other countries? They've been more successful in Singapore. They can be more successful in other countries. Both of you have ignored this argument, right?
I think that we're right to ignore it. I think that we are worried about how to make America work better. And,
but make America worse can make the global better.
Now,
because more people found more valuable jobs elsewhere.
Hold on. Let him respond.
Just the notion is that I am sensitized this year in this political campaign as somebody who's been a big fan of globalization, as I have been, saying, you know what, in the course of this, I have not been paying sufficient attention to ways in which my fellow Americans have been screwed over in ways that don't affect me. And so I am, in fact, worried about how to make America work, and I'll worry about the rest of the world later.
Next question.
Okay. So toward the back there, hand up, the gentleman. I thought about calling only on my AEI colleagues, but I'm not sure that would be a good idea for me on this topic.
Oh, thank you very much. So a strong assumption in the plan seems to be that people will either make good financial decisions or be pressured by their social networks to make good financial decisions. However, there's strong evidence in psychology that people who are in poverty actually think about money differently and think in a more immediate term sense. Anecdotally, I've seen that as a Peace Corps volunteer, and I've seen it in my friends. So in your plan, do you cite any sort of scientific evidence to the contrary? Have you taken that research into account at all?
My basic statement about this is, even if everybody squanders everything and makes no provision for their retirement whatsoever, they're getting their $10,000 a year until they die. And if you are two of them, that's $20,000 a year. So that is the completely improvident, the completely stupid and unthinking and no future time horizon. But I will tell you what you can kind of guarantee, and that is that certain things about money, if everybody has 10 grand, and about investments that are common knowledge among the people in this room, will be the topic of conversations in barber shops and in cafes and bars in ways they aren't now, such as, you know what, somebody's going to walk into the bar and they've got this great get-rich scheme where they're going to buy tulips. And yeah, there will be people who do that, and there are also going to be lots of other people around the bar rolling their eyes and say, you know, what you need is really diversified portfolio. Things that are not said in bars now and in barbershops now are going to be a lot more widely spread then. And it's part of something that Jared and I did not get to at all. The ways in which, when everybody has 10 grand, the dynamics change within communities and how people talk to each other and the assumptions they make about each other, about victimhood and all the rest of that, but I won't go off on that.
Let me respond also. So, that's an objection that I have as well, as I tried to suggest in my comments. I worry that people will underinvest or inadequately invest, and especially I can't imagine why we would break a system that guarantees a pension now, which on average pays more than $10,000 a year.
But it doesn't guarantee it to everybody.
And well, so that's the thing. I mean, again, this will be for our argument
Okay.
on the blogs after this, but I think Social Security is actually an extremely pervasive program, and any citizen who's been in the country for the requisite amount of years is going to get Social Security either themselves or through their spouse. But let me just say this. Where I have a similar objection that did come up is in Charles' healthcare plan. So this is basically it's a catastrophic plan where this is where you have to take $3,000 off the top of the demo grant and buy this catastrophic healthcare in the private market. And so this is basically just a very high deductible plan. And here the psychology that the questioner mentioned comes into play as well. Because what we have found is that, especially for low and even middle income people who have a high deductible plan, it doesn't make them more price conscious, it doesn't make them shop more adequately for insurance. What it does is they don't go to the doctor when they're sick. And so it ends up actually costing more because they don't get preventive care.
Let me see who I'll go here and then I'll go back there.
Robert Rector, the Heritage Foundation.
Could you speak up a little?
Robert Rector, the Heritage Foundation. I'll try to make these questions, but just start out, Charles, what he's saying about the marginal tax rate of welfare is right. You're wrong. What you're saying about those high marginal tax rates hasn't been true for 25 years. And mainly that's because as food stamps go down, the EITC and ACTC go up, and they net each other out. And until you get to earnings of around $20,000 a year, the marginal tax rates are actually around 17%. There are a few anomalies where that's not the case, but you treat anomalies as anomalies. Secondly, you talk about, making progress against poverty, making progress against deep poverty. Well, you know perfectly well that the reason we have deep poverty and poverty is because the EITC and food stamps and public housing aren't counted as income. And if you count those things as income, then you cut the poverty rate at least in half. The deep poverty rate essentially disappears for families with kids. So it's a lot easier just to count rather than abolishing Social Security and Medicare as a way of getting rid of poverty. Just count what we already spend, count it accurately. But so here are two questions.
Yeah.
My calculations would be that if you abolish Social Security and Medicare and were to do this to tomorrow and transfer it in your system, the cost of that in terms of lost Social Security benefits to recipients is $378 billion a year. The cost of lost Medicare benefits is close to $400 billion a year. Now, I know you have transitions and stuff, but when the popular accounts of this really don't emphasize the fact
What's
that
the
this.
question, Robert?
Okay, it's a huge transfer from the elderly to others. Second question.
What was the first one?
Here's the simplest
Robert,
version.
take
The
serious.
simplest.
We want to.
Seriously, Robert, we got lots of
room
people
for
who
other
want us.
All right,
You've made a
answer
lot
that.
of great points. So,
Okay, I was going to go back.
you want to respond? Or?
No, I'm willing to say I've got to look at the marginal tax rates again.
Yeah.
Although in disability, is that true?
Thank you.
Disability
Sasha Gong from Voice of America. My question here, I remember in Coming Apart, you talk about the loss of pride, especially working class men's pride, which create enormous social problem. What will your plan do to the pride, especially lower class, working class pride? And would that help, increase marriage, the incentive of marriage, or decrease the incentive of marriage, as you pointed out in your book?
I run through the alternatives for what this will do for marriage, and there are different outcomes for different people who have different propensities to get married. I'll tell you a couple of things that I think where the incentives will be gotten right. And one of those has to do with children, having children. From the woman's point of view, today, having a baby creates an income stream. I am not making any collateral statements about her getting pregnant so that she can get the money. I'm saying having a baby creates an income stream. Under the UBI, having a baby is a drain on an existing income stream, and that's as it should be. Having a baby should be something we say, we know it's going to cost a lot of money, but we really want to do this. For the guys, it's much more blunt and much more brutal, and I think appropriately so. You now have a case where you cannot enforce child support on a guy who walks away from children he's fathered, because either he's in the gray market or he has no income or whatever. Well, under a UBI, he has a known bank account with electronic deposits, and it's real easy these days to establish paternity beyond a shadow of a doubt, and all the judge has to do is say, X number of dollars every month, garnished from you, you'll never see it, it goes directly to the child. You think that maybe that'll get around? You think maybe guys will see that, that fathering babies creates a drain on their income stream and it might change the incentives? So with issues of marriage and issues of pride in work in the book, and I recommend people look at it, I think there are lots of ways in which you're going to create what I like to call valued places, where people are functioning in their communities in ways which gain them the respect and give them status for what they're doing. Those are elaborate arguments I'm not going to try to say talk about here. And just jump in whenever you want.
Okay, sure.
Yes, right in here in front.
Thank you very much, both of you. John Graham, National Center for Policy Analysis. My question is, going back to, say, the civil society, restoring civil society, and looking back at, for example, 19th century New York, what would be both gentlemen's explanation for why voters decided that wasn't good enough, and over the last century we've added on a federal welfare state? And to sort of suspend our political disbelief, if Paul Ryan got up tomorrow and said this is it for the next term, wouldn't the Catholic Hospital Association be first in line saying, no way, Jose? So those organs of civil society don't really want what you're proposing.
You know, I'll be real quick with my response to that. Books have been written about that question, okay? But I will say, to me, one of the things is that the first programs that were done first for the people who were the greatest objects of sympathy, namely widows with children. That's where we've got the first national welfare program. And the second thing is, it seemed simple at the time, and that was true also in the 1960s, and incrementally as the welfare state built up. People don't have jobs? Give them jobs. People don't have skills? Well, send them to job training. Mothers don't know how to take care of their children? Teach them parenting. It seemed to be simple, and it was only after you began to get these layers built up that it became obvious that you got all sorts of moral hazard problems, you got all sorts of implementation problems. It's not simple. But by that time, a great deal of what had formerly been assumed to be the responsibility of families and communities, it's the government's job.
So, I mean, I really have a very different view of that. Let me put it this way. You know, look around at every advanced economy. Do you see any UBI schemes? Answer, no. Do you see any, quote, welfare states? The answer is in every single one, okay? And by welfare states, which it becomes very much a pejorative, what I'm talking about are advanced civil economies that decide that our elderly should not be poor, our elderly should not be health insecure, that in fact it's better to provide low-income moms with kids with the resources they need to raise their child as opposed to somehow deprive them as some kind of punitive measure. What you see in every country is way more of this type of social intervention than we do here. And if anything, we've moved closer to some of that, at least when it comes, as Robert was saying, to some of the programs that incent work. And I think this is a positive thing, the child tax credit, the earned income tax credit, in part because we recognize that it is bringing in the political view, in part because we recognize that it is consonant to Americans to consider work as a ladder out of poverty. And People who aren't on these programs have to work to get out to be non-poor. Seems fair that others should have to work as well. That I think is a general mindset. And so that's why I, at the end of the day, say if we're going to actually solve some of these problems, and I agree with Charles and Nick that there are a lot of guys who ought to be working but aren't, we ought to guarantee them jobs. And in fact, during the recession, during the Recovery Act, we had a program, a subsidized job program. We subsidized wages to the tune of 80 or 90%. This is the TANF Emergency EF program. We subsidized wages in private or public sector jobs to the tune of 80 or 90%, employed about 260,000 people, time limited. I thought it was a pretty successful program.
We have come to the end of the time. I will just close by saying that in a year which has been characterized by incredible polarization, when people who disagree with each other, it has been assumed, must hate each other, I think Jared and I have done a terrific job.
It's always great to have.
Yes, it was.
I agree.